comments.
Thank you, Chairman Guthrie and Ranking Member Eshoo, for holding this hearing, and thanks to all the witnesses here today. I'm glad to see this committee is continuing our work to advance initiatives to expand telehealth access for Hoosiers and, of course, all Americans. It's critical for patients in southern Indiana that our community build upon the success of the flexibilities provided for telehealth services during the pandemic. My colleague, Congressman Buddy Carter's legislation, which I'm proud to co-sponsor, the Telehealth Modernization Act, would make permanent several of these flexibilities. Likewise, the advancement of telemedicine for mental health services could greatly expand access to patients in need, especially those in areas like mine, rural Indiana, which the VA is actually doing. I continue to hear about workforce shortages in my district across the healthcare industry, doctors' offices, hospitals, everyone's got the problem. During the Trump-Pence administration, HHS, USDA, and the FCC came together under a MOU for purposes of expanding access to telehealth services. Together, these agencies collaborated to utilize their collective expertise so that rural patients in underserved areas could be connected to the care they needed whenever they needed. I've continued to encourage this administration to build upon this success. I'm going to ask all of you the same question if we have enough time. At the onset of the pandemic, hospital systems in Indiana, such as IU Health, successfully ramped up various types of telehealth services, and Hancock Regional Hospital utilized patient monitoring services and portable camera systems so that doctors could maintain constant access to these patients. As you know, treating some types of heart conditions using telehealth services could require constant patient monitoring or hybrid care integration. In 1988, I worked with a man who plugged into his dial-up telephone and it checked his heart. And wasn't that I'd call that telehealth medicine, right? And now we're trying to decide where we're going to go with telehealth medicine. It worked for him and it worked great. So, Dr. Schwam, you said that this was an untapped potential, okay? And if you could all give me a quick 30-second answer. Can AI play a role in expediting telehealth?
Absolutely. You know, so many of the things we do, we still do manually today, not just on the front end, but also on the back end, the processing, the claims, the prior authorizations. We have a huge opportunity to declutter and reduce administrative burden that allows clinicians to practice at the top of their license and to focus on creating care pathways for how your care should proceed after you leave the office, that AI can help power a journey for you with reminders in the format that would be best for you, a phone call, an email, a text message, and monitor your progress. And if you don't deviate, you don't need another human touching you on that journey.
It's Representative Hudson, he kind of had a two-tier system, right? In-person or telehealth, but maybe AI is a third tier. Is that possible?
Absolutely. This is hybrid integrated care. This is what care should be.
Okay.
And I want to also just emphasize
right to left.
that AI is already here. Hundreds of hospitals in the United States are already using AI to, say, diagnose certain conditions such as stroke, pulmonary embolism, and so forth. And the hope is, obviously, and the appeal is that we can actually identify diagnoses that would have been missed. So I just want to emphasize it's already reality.
Good. Dr. Cunningham.
Thank you. I would just say that AI is not necessarily a different layer of care. AI augments care, whether it's in person or it's virtual. And there are many different technologies with a lot of promise to facilitate in augmenting care delivery to make it more efficient, both for the patients and for the clinicians.
Ms. Ashlow.
I'm sure the society staff would be happy to provide more details about that question. And my experience is more personal.
Okay.
And I'm happy to answer any questions related to that.
And you, last but not least.
Quickly, I think we just need to urge and have caution with the use of AI. I know that when medical decisions are made, they really should be between the physician and the patient, and that is in-person care is the gold standard, and telehealth should be a supplement to that. So I just urge caution as we roll out AI initiatives.
Okay, thank you all very much. Mr. Chairman, I yield back.